Hello, this is Dr. Bouvier with Dr. and You, and this is an instructional video on one of the pearls of clinical expertise. And I've got a longtime patient here. She's also a nurse, so she's up for student education and further education for medical reasons. And she had a little accident. She got a little dizzy standing up, hit the couch, and fell against the
wooden stool.
Wooden stool. That's about 6 days ago, right?
Yes.
And then about 24 hours later, go ahead and stand up for a minute. This occurred. See this bruise right through here? Now, the key factor here is 24 hours. So go ahead and sit down. So I'm palpating this, and it really wasn't painful over the ribs. But this is 6 days, 7 days later. So, but I said, okay, then let's find out why. The key factor there, 24 hours. If this is a rib fracture, then 24 hours you start seeing the bruising. Well, within 24 hours. If it was 2 or 3 days later, you start thinking of, jerking a kidney loose and hematoma on the liver, Gleason's capsule, hematoma around the kidney, and so all these things are playing in your differential. So we got a stat x-rays done today, and also ultrasound of her kidney and liver, just to make sure there wasn't hematoma. And we also got a thing, little used these days, but we call it a sniff test, S-I-N-F-F, sniff test. And
That's about all I did.
Snort in a couple of times, and we do that while we're watching the diaphragm under fluoroscopy, right? Mm-hmm. And you can do that with a C-arm. You can do it with a regular fluoroscopy unit. You can use it in a cath lab, but any kind of fluoroscopy, you can check that. And you watch the diaphragms moving up, and it sniffs normally. Right? Mm-hmm. It's a rapid sniff, and so you order that way. So she's gone through stat lab, which is not quite back yet, but and we're waiting for that. But what happened with her is that the clinical history was 24 hours, rib fracture, but let's make sure that the kidney, spleen, and that the diaphragm was not ruptured, because she hit hard enough and hit hard to fracture 2 ribs. So we know that that's hard enough to bruise a kidney, causing hematoma, which can cause kidney damage, and then liver, which can cause liver damage. If this was on the other side, of course, we would worry about a spleen or a splenic rupture, and rib fractures, of course. So these are the clinical pearls that you want to understand about this type of trauma, and you have to be alert to it. So number one, 24 hours is usually rib fracture. 2 or 3 days, it's usually some viscera that is fractured, or possibly diaphragm. And understand the sniff test, the stat ultrasound of those organs, and also just standard rib x-rays. So again, this is Dr. Robert Bouvier, and thank you for permission to pass this information along to everybody.
No, I enjoyed it.
Thank you.
Watching what they were doing.
Now you were a corporate nurse, right?
Yes, I worked at a General Motors plant.
Yeah, cool. Well, thank you for your service.
You're welcome.
Again, this is Dr. Robert Bouvier. Thank you very much.